15 Common Mental Illnesses Crash Course. Mental illnesses are a diverse group of conditions that affect a person's thoughts, emotions, behavior, and overall well-being. It's important to note that mental illnesses are complex and can manifest in various ways, and they often overlap with one another. Here are 15 common mental illnesses along with brief descriptions of each. 1. Depression, a mood disorder characterized by persistent sadness, loss of interest or pleasure in activities, and a range of physical and cognitive symptoms. 2. Anxiety disorders, a group of disorders that includes generalized anxiety disorder, panic disorder, social anxiety disorder, and others characterized by excessive fear or worry. 3. Bipolar disorder, a mood disorder involving periods of depression and periods of mania or hypomania, which can include elevated mood, increased energy, and impulsive behavior. 4. Schizophrenia, a severe and chronic mental disorder characterized by distorted thinking, hallucinations, delusions, and impaired functioning. 5. Post-traumatic stress disorder or PTSD, occurs after a traumatic event and is marked by flashbacks, nightmares, and severe anxiety. 6. Obsessive-compulsive disorder or OCD, a disorder characterized by recurring, intrusive thoughts and repetitive behaviors. 7. Attention Deficit Hyperactivity Disorder or ADHD, a neurodevelopmental disorder marked by inattention, hyperactivity, and impulsivity. 8. Borderline Personality Disorder or BPD, a personality disorder characterized by instability in relationships, self-image, and emotions, as well as impulsive and self-destructive behaviors. 9. Eating disorders, including anorexia nervosa, bulimia nervosa, and binge eating disorder. These are marked by an unhealthy relationship with food and body image. 10. Autism spectrum disorder, a developmental disorder that affects communication, social interaction, and behavior. 11. Substance use disorders, conditions involving the misuse or dependence on alcohol, drugs, or other substances. 12. Alzheimer's disease, a progressive neurodegenerative disorder that primarily affects memory, thinking, and behavior in older adults. 13. Major depressive disorder, a severe form of depression characterized by persistent low mood, significant weight changes, sleep disturbances, and more. 14. Phobias, exaggerated, irrational fears of specific objects or situations, such as arachnophobia or acrophobia. 15. Seasonal affective disorder or SAD, a type of depression that occurs at the specific times of the year, often during the fall and winter months due to reduced exposure to natural light. There are various mental illnesses, each requiring specific treatment approaches. Treatments may include psychotherapy, medications, or a combination of both. The best course of action should be determined based on the type and severity of the disorder and individual needs. From counseling to therapies and medications, there are diverse treatments available for mental illnesses.